Have you ever been told that multiple sclerosis is a very treatable and manageable disease? If not, I'm Paula Hardemen, a physician assistant of neurology and an MS specialist, and I'm here to tell you that it is. I'm going to walk you through the treatment options and symptom management strategies that can help you live a full, healthy, and active life with MS. First, let's break down the type of treatment options you have available to you and what you should consider when making that decision. When living with MS, there are two categories of treatment. First is immune modulation. This type of drug changes how your immune system behaves in your body, but to be clear, it does not destroy your immune system. The benefit is the drug has less risk factors. For example, there is less association with cancer development or infections. The concern, however, is that immune modulation drugs tend to have a lower efficacy. The other category of drug is immune suppressive. These type of drugs suppress the immune cells, meaning they kill off certain immune cells that are harming your body. The benefit of this is it is a highly effective category of drug. It reduces relapses or the progression of your disease. However, the concern is more risk is associated around infections and the potential development of cancer. Within these categories of treatment, you must also take into account the following. First is drug administration. Treatments can be administered in different ways. The options are mainly oral, injection, or infusion. The question you and your doctor should be asking is, how is it going to affect your lifestyle or your day-to-day? For example, if you travel often, you may want to opt for an infusion so you don't have to worry about bringing in injection tools or your pills with you. Next is drug monitoring. Monitoring your treatment is crucial to your safety, but each type of drug is monitored differently. The riskier drugs are going to have more frequent lab monitoring. So again, how will this affect your day-to-day? Consider the time commitment and the access you have to a lab. Finally, is considering your future childbearing options. Some of these medications will not be advised if pregnancy is in your plans for the first few years of treatment. Outside of disease-modifying treatments, there are other symptom management strategies and lifestyle behaviors that can help you to manage your MS. First is prioritizing a balanced diet. Currently, there is no recommended diet that has shown to be beneficial for MS. However, if you focus on eating more fresh fruits and vegetables, you will notice an overall improvement in your fatigue and mental clarity. Another way to manage your symptoms is to practice good sleep hygiene. I always tell my patients the bed is for two things: sleep and sex only. This is important while we are in this tech world. No phones, iPads, or computers in the bed. If you do allow these things in the bed over time, you are training your mind to think about bed not just being for sleep. Another suggestion is to introduce a bedtime routine, but be sure to make it your own, whether that's by turning down the lights or volume of the TV, or by finding things to help you relax, such as a bath, shower, hot tea, stretching, or deep breathing. It also helps to be intentional about what you're sleeping in. The less clothes, the better. Finally, be intentional about who's in bed with you: dogs, cats, kids, or spouses. If they are keeping you from getting good quality sleep, consider having them sleep in a different bedroom. Having good sleep at night will lead to better symptom management the next day. Additionally, staying active can be a great way to manage your MS. This doesn't necessarily mean running a marathon. It means moving for 20 to 30 minutes throughout the day. Your daily movement doesn't need to be continuous. It can be broken up into intervals. Can Do MS recommends short bursts of exercises while you're watching TV or waiting for your food to cook in the microwave, and has tons of suggestions on their social media channels. Your movement doesn't have to be high intensity either. The value of stretching is immense. Our bodies are made to be flexible and moving, but most of our way of life keeps us sedentary and sitting. Stretching 5 minutes a day, morning or evening, can make a huge difference. These management strategies and lifestyle behaviors are just the beginning of how you can best manage your MS. You can build yourself a whole healthcare team to support the life you want living with MS. Let's start with your neurology provider and your primary care provider. These are the top two on your team and the ones you might see the most often. They should collaborate and work well together. Your primary care provider can follow up on things that neurology will not manage, like preventative screenings for cholesterol and blood pressure. While there are certain medications that your neurologist could use that may affect those screenings, which is why they need to communicate, but ultimately, they need to work well as a team. Outside of that, who you choose for the rest of your team depends on your symptoms. Here are some to consider. A urologist can help with bowel and bladder symptoms. A rehab specialist or a physiatrist can assess your overall movement and address spasms, muscle, or skeletal pain. An occupational therapist can provide adaptations for your home and your daily life. A physical therapist will help you with walking and balance, identify the need for mobility aid, or help you build out an exercise routine. A speech-language pathologist can help you with speech and swallowing. However, they can also provide baseline cognitive testing and rehab. A neuropsychologist can also address those cognitive concerns and identify areas for improvement through testing. A mental health professional is important if you're experiencing depression or anxiety from your diagnosis, or if you need help managing challenges that arise. I know I just listed a ton of healthcare providers to consider, which can be overwhelming and sometimes just outright unfeasible. But that's why organizations like Can Do MS exist, to get you connected to a wide range of perspectives to help you live better with MS. So how do you find people to add to your healthcare team, and what options do you have to make sure that your team respects your goals, values, and culture? If you're in a metro area and have access to an MS center, I strongly encourage you to establish a relationship with them. They will have a network of healthcare professionals that specialize in MS. If not, there are different groups like Can Do MS that provide access for people like you to educate themselves and get connected with other people in the MS community. They can also share resources with your current provider so they can learn how to provide you with better care. As you learn to manage this disease, your health can be greatly improved by the people you surround yourself with.